Hi, Dr. D. Pasquale with NSI Stem Cell, and I'd like to talk to you a little bit about cardiac function or heart function, and as it relates to stem cell therapy. So when we have issues with the muscles of our body, if we have damage or dysfunction in the muscles of our body, we know that there's a very specific mechanism for stem cells to repair and regenerate and to promote an improvement in function in those tissues. The heart is no different. The heart is a form of muscle. It's cardiac muscle, a little bit different than skeletal muscle and smooth muscle, but it is a muscle nonetheless. At the end of the day, what we can do is we can provide stem cells in an environment, or at least put them in close approximation to heart muscle so that we can improve the function and we can repair and regenerate heart muscle. There are amazing studies that suggest that the ejection fraction of the heart, which is basically the heart's ability to push blood flow throughout the body, improves dramatically after a heart attack. So what happens with a heart attack is there's lack of blood flow to the heart muscle. It becomes damaged. And as a result, it's very difficult to get that back. So in terms of long-term quality of life and disability, after a heart attack, that's where it lies. Patients become fatigued. They don't have the ability to get blood to their extremities or to the rest of their body in the way that they could prior to the heart attack. What we see now in the literature is when we inject stem cells intravenously, because first pass is through heart and lungs, we can greatly and dramatically affect the heart muscle and improve it to a degree that we've never seen in the past.